One of the things that Toby Cosgrove did talk about was AI, and he and Ed were talking about, what's the one thing that you've seen that you think is really going to impact healthcare? And he said AI, hands down, is going to change so many aspects of healthcare. Where are you at on AI, and what's your current thinking, and what are you telling your organization about it?
What do you think? So AI it's one of those things that becomes like it becomes so big. It's the elephant. Like, how do you eat it one bite at a time? And I'm like, go after the things. I don't know if you were aware, there was the recent summit, innovation summit, The Economist hosted, and they really talked about the components of AI that are poised to help healthcare in the easiest way. So we always think about it like diagnosing the patient, and did Watson go read 5 articles and spit out, hey, you should go take 2 aspirin and call me in the morning? Or is there ability to cultivate millions and millions and millions of pieces of information and data and ask you thoughtful questions about helping to create your diagnosis, which is why no matter how advanced AI becomes, you're still going to need that art of the physician to interpret and deliver the data and have a thoughtful conversation. When I think about AI, I mean, there's that huge patient-facing push, which is absolutely important. I want to know that if I've been hiking in Maine and I'm in Southern California and have all these weird symptoms, that the system's going to be thoughtful enough to say, oh, well, you were in this part of Maine and there's Lyme disease present in that area, and maybe ask questions to help diagnose it. But let's use it for things that are like low-hanging fruit. Let's use it for things like, these patients are going to have a hard time paying their bills, or these patients are going to have a hard time being medication adherent because of these factors in their life, and approving access to emergency care based on rural areas, or those critical access hospitals that are harder to get to in certain areas, but you're seeing a prevalence of these types of conditions. I mean, using it for the basic blocking and tackling, it doesn't have to be profound. It can be like, these people are going to have a hard time paying their bill, and here's what we can do to help them ahead of time. That's where I like to see the emergence of AI coming into healthcare. At least if no one knows where to start, or if you had to jump into it, those are some areas where it really can be beneficial to your org.
Yeah, I agree.